Artificial sweeteners is erythritol a perfect sugar substitute? Uncovering the hidden risks. Hello everyone. Today, I want to talk about artificial sweeteners, something many of you are curious about and consume regularly. We'll specifically focus on erythritol, which has recently gained attention due to new research findings. Is an artificial sweetener really a perfect substitute for sugar? Let's explore this question together in today's video. Why are artificial sweeteners so popular? You've probably seen sugar-free or zero sugar labels on drinks and foods everywhere these days, right? For those who want to reduce their sugar intake, but can't give up sweetness, artificial sweeteners are a very attractive option. Artificial sweeteners have little to no calories compared to sugar, and they have less impact on blood sugar levels, making them a welcome choice for diabetics or those managing their weight. Among them, erythritol, which we'll focus on today, has been widely used in sugar-free and low-carb products since it was approved by the U.S. Food and Drug Administration (FDA) in 2001. It's known to be about 80% as sweet as sugar, and has almost no effect on insulin secretion, earning it a lot of popularity. Erythritol or their hidden dangers? However, recent and somewhat concerning research findings about erythritol have been published. This research comes from a team led by Professor Christopher D'Souza at the University of Colorado Boulder. This study is significant because it's the first to identify, at a cellular level, how erythritol affects the function of brain blood vessel cells. The research team conducted an experiment where they treated brain blood vessel cells with the amount of erythritol typically found in one glass of a sugar-free beverage for 3 hours. The results showed surprising changes. First, there was a significant decrease in the production of nitric oxide, an important substance that relaxes blood vessels. At the same time, they observed an increase in endothelin-1, a protein that constricts blood vessels. Simply put, the blood vessels reacted by narrowing. Second, the production of tissue plasminogen activator TPA, which plays a crucial role in dissolving blood clots, was significantly inhibited compared to normal cells. Blood clots, as you know, are when blood thickens and can block blood vessels. A reduced ability to dissolve these clots is a serious issue. Third, there was an increase in reactive oxygen species, which also showed an increased potential for cell damage and inflammatory responses. Reactive oxygen species are harmful substances that can attack and damage our body's cells. Professor D'Souza explained that considering these results, when blood vessels constrict, and the ability to remove blood clots decreases, the risk of stroke inevitably increases. He added, this study clearly shows the biological mechanism by which erythritol can increase these risks. Epidemiological study results supporting the cell experiment. This cell experiment isn't just showing changes at a cellular level. Recent epidemiological studies involving 4,000 adults in the US and Europe have reported similar findings. This epidemiological study found that people with higher blood erythritol levels were significantly more likely to experience a heart attack or stroke within the next 3 years. This cell experiment was conducted to identify the biological cause of this epidemiological association. The two research findings support each other, sending a warning about the potential risks of erythritol. So, should we avoid erythritol entirely? Of course, it's too early to conclude that we should completely eliminate erythritol, based solely on these research findings. Professor D'Souza noted that while this experiment was conducted with a single serving amount of erythritol, the risk could be greater if consumed multiple times a day. He also emphasized that these results are from cell-level experiments, and large-scale clinical studies involving actual humans are additionally needed. However, what's important is that we need to think twice about artificial sweeteners that we might have consumed unknowingly. The researchers recommend that consumers carefully check food labels for products marked with erythritol or sugar alcohol. And Professor D'Souza stated, combining the epidemiological research and these experimental results, it would be prudent to control your own intake of non-nutritive sweeteners like erythritol. Smart choices for healthy sweetness. In conclusion, artificial sweeteners can be a good alternative to sugar, but not all artificial sweeteners can be considered perfectly safe. For specific sweeteners like erythritol, further research is needed, and it's wise to adjust your intake considering the current research findings. The best approach is to reduce your consumption of processed foods and enjoy the natural sweetness of whole foods. Natural sweetness from fruits and vegetables also provides our bodies with necessary nutrients. I hope today's video was a small help in developing your healthy eating habits. If you have any questions, please leave them in the comments. I'll be back with more useful information in the next video. Thank you.